Aloha from the Big Island in Hawaii. I'm Dr. Seemal Desai. I had the pleasure today to speak about vitiligo and other pigmentary disorders. And in this particular session, I focused this mainly around clinical case potpourri. We actually started with talking about what's new and exciting in vitiligo. Of course, what's most exciting is we finally have an FDA-approved treatment to help repigment vitiligo in patients ages 12 and above, which is called topical ruxolitinib 1.5% cream, which is used twice daily, typically in less than 10% body surface area. But we also focused on other options for treating recalcitrant vitiligo, like depigmentation therapy using monobenzyl ether of hydroquinone, combining it with spot liquid nitrogen or low fluence Q-switch Nd:YAG laser, particularly aimed at evening out resistant patches of normal skin admixed with the patient's vitiliginous skin when they want to achieve a uniform appearance. We also talked about melasma and recapped the uses of oral tranexamic acid. Though FDA off-label, can be very effective in treating recalcitrant melasma, typically at doses of about 325 milligrams twice a day. Of course, you have to screen these patients for any risk of blood clots, looking at clotting parameters, oral contraceptives. You want to be careful because it is off-label, but this certainly can be effective. And then finally, we touched on lichen planus pigmentosus, another vexing condition which we predominantly see in patients with skin of color, and the use of low-dose oral isotretinoin for these patients who are suffering from this more reticulated pigmentary anomaly. And we're seeing lots and lots of these cases in our practice. Catching it early and quickly can be very, very effective. So there's lots on the horizon for pigmentary disorders, melasma, vitiligo, lichen planus pigmentosus, all of the above and more. And hopefully at the next meeting, we'll cover even more hot topics.